Welcome back to Foundation Friday. So what we're going to talk about today in our series for injury prevention, so that prehab, even rehab, or just overall health and wellness is what we can do to, if it's working on our muscle mobility, and then of course with connection to breath, with stress, and with sleep and recovery to perform at our best. So we're going to talk a little soft tissue myofascia release. So within our topics, you'll see we have, when we have that thought about injury prevention or what may be causing that repetitive injury, is there a stability issue, right? Are we able to stabilize a certain position with load? And then we have mobility. Do we have end range of motion to perform that skill or activity in the joint capsule and or within our soft tissue? Third, do we have the strength mechanism to actually make this happen? And then lastly is motor control, right? Do we have the preparational skill? Do we have the patterning? Or just become second nature? That's just what we do each time. So we're going to kind of dive into this mobility aspect, into the muscle mobility side of it with that self myofascial release, things you can do for yourself to basically at the end, hey, can I get out of pain? Can I sleep better? A lot of stress is held within our inflammational aspects of fascial tissue. Can I recover better, get back into my sport, my activity? And then also for performance as well, to improve performance. So within our soft tissue there, we can utilize certain aspects of this. And sometimes we have the terminology of trigger points, adhesion. And basically soft tissue that we're talking about in that fascial system is encapsulated over that muscle, right? And we can talk about the variants of different levels of this and what this might be, of just a sliding filament collagen fibers there. Is it basically approximated like pretty straws, or is it like a spider web? And sometimes we feel that it's that knot, right? And then we just kind of lack that movement because again of this barrier. So if we're talking trigger point, adhesion, or not, we know there's something junky kind of going in our tissue that's limiting our range of motion. So what can we use to work this soft tissue there? So we have like tennis ball, lacrosse ball. You can utilize something like this. Foam roller. Second half of this video will actually, or we may post a second video on how to utilize one of these things. If you do have a ball at home, foam roller you kind of picked up at the store. So we can roll on this foam roller. We can just kind of smash to certain areas too, put that pressure, like the massage. We have our scraping, gashant or some sort of roughing type technique on that. And then there's that tacking can be utilized. So a lot of different methods there we can kind of utilize to kind of work our soft tissue there to relieve, that free adhesional issues there and movement. So 2 minutes normally on a certain area that we want to work on for change. And then one of the key things is breathe, right? Make sure we're breathing throughout this. Even if we're doing off of this some sort of stretch, relax, or dynamic, is make sure we're nose breathing, okay? Belly breaths in, exhale, because again, with compression, with that ball, with that foam roller, and breath, it's basically gonna send that signal to our brain, right? Hey, relax, right? Remember, we're okay. We're not in danger, so we can relieve that knotted tissue fascial system. Okay, so remember again, we want to hopefully get out of pain, right? We want to sleep better, so we can utilize this, before bed in our sleep hygiene habits there. The connection with stress is high with this, and of course, recover, perform at our best.